Good morning. This is Penelope Jones, and I would like to introduce you to working posture. I'd like to invite you to new possibilities, and that is to see differently the way people who sit all day unfortunately end up with problems. So I've been running these working posture workshops for about 30 years. But maybe I need to tell you a little bit about where I'm coming from. Well, I spent 10 years in general practice in dentistry before I then went off to become an endodontist. I worked in general practice in the UK and in Australia. During the time I was away, I developed a lot of problems. And when I found out about the Feldenkrais method, I decided I should try it. So 35 years ago, I trained as a Feldenkrais practitioner, and this is about, it's down at the university in Melbourne called La Trobe at the Health Sciences Institute, and it's about neuroplasticity, human movement, and human development. And when I came back from that, I have had no problems since then. So I thought, well, I really need to share this with everybody else. As you can see, the Feldenkrais method is doing classes, as you can see in the top picture, and sometimes I actually do physical hands-on work with people. Okay, so working posture's aim is to deal with the pain and the discomfort that comes from working in a dental office and sitting all day. It affects every level of your being, I know. It can undermine your confidence in your body, it can reduce your joy for life, and it can even create depression and end your working life, which is not a good thing. So normally, when you start to have problems, the medical model is that we look for the broken bit or the dysfunctioning part, and then we set about trying to fix it. And this is great, and it's what the medical profession is really, really good at doing. But what if the doctors and the practitioners do their very best, but you're still having discomfort or pain? What happens if all the x-rays and the scans, etc., show that there's essentially nothing wrong, but you still have problems? And what if they've done their very best and they probably do a great job? What if the problem keeps coming back again? So I'd like to share some ideas. We have to think differently about our bodies. It's no longer tenable to think of our body as a machine with levers and hinges, etc. We have to look beyond this because the way our body operates is way more sophisticated. We also have to stop thinking that by the age we're an adult, our nervous system is fixed and we can't change it, because we've found out from neuroplasticity that it's not true. It can be changed. So we need to think in terms of systems theory, function, neuroplasticity, fascia, and integrity. And I'm going to take you into these. It's a lot of work, and I hope you can follow it. I just hope it helps you think differently about how your body works. So my Feldenkrais training is what underpins working posture. But I do more than that. I also incorporate the things that I learned from sitting as a dentist all those years, and the things that I come across in my practice when I see what dentists end up with, and also in my workshops when I see the way that dentists actually move, etc. And I find, unfortunately, as a profession, even though many of them do a lot of sports, they become very stiff. So it taught me to think differently about how the body functions and how we end up with the problems that we do. So I've divided this up between 4 main topics. The first one is function. The second is neuroplasticity. The third one is fascia. And the last one is tensegrity. So Feldenkrais method is primarily about addressing function. In our medical model, we go about, if we have pain in the neck, we treat the neck. If you have problems in the lower back, we treat the lower back. But with the Feldenkrais method, we look at the functioning of the whole body. And I'll explain that, why that's important. We actually look at how the whole body works. We can actually change the function of the whole body, not just physically, but emotionally and intellectually, with neuroplasticity. So what is neuroplasticity? Let's have a look and see how aware you are actually of how your body functions. Just put your hands together like this. And now look down and see whether you have your right thumb on top or your left thumb on top. I'd like you now to take your hands apart and put them together so that the other thumb is on top. And so the fingers will be intertwining in a different sort of way. How does that feel? People say it feels weird. People say it feels different. It's certainly not normal, is it? So why has this happened? This is because every time in your life that you've put your hands together, you've put them together the same way. And when I'm asking you to change, that's something that you probably never do because you'd notice it, wouldn't you? So this is to illustrate that everybody has their own way of organizing their body. Now, if you have your left thumb on top, it might be because your shoulder is higher on the left-hand side. It could be that you stand more on your right foot, or it could be that the ribs on the right-hand side are more concertinaed and more contracted. So everybody's got their own way. So how does it end up being like this? Well, when you were a little baby, you came into this world all innocent, and you were able to only do things like cry and breathe and suckle and eliminate, etc., and do very, very basic movements. You couldn't do all these sophisticated things that we do as adults. You had to go through an apprenticeship. And during this time, those gross body movements, you interface with the rest of the world. And the nervous system is so in a learning position at that time. It's the time when you absorb and learn the most. So by interfacing with the environment, you start to feel yourself. You start to feel what movements feel good. You start to feel what movements get you something. And this then gets built up gradually over time to more and more sophisticated pathways until you can do all the amazing things that you do. On the way of this development, things interfere with a smooth transition. Sometimes we have accidents, and what happens when you have an accident is the part that's injured, the muscles contract around that to brace it so you don't injure it anymore. Now, if you're in a place where you're very curious about how your body moves, etc., this is no problem because you develop your way through this. But normally what happens with people, this stays as part of your neurological patterning because it goes into the unconsciousness. This can stay for the rest of your life. And this is sometimes what causes problems later on because those patterns of contraction are still there and they're activating when you get tense. The other thing is that we develop bad habits, and I'm going to talk about those later on in the lecture. When you develop bad habits, you also develop patterns of muscle contraction, and these they go out unconscious, but they stay for the rest of your life, unfortunately. So we build up our own unique neurological patterning, and it's almost as if we've got a neurological straitjacket on it. And this is something that's not taken into account when you go to have regular medical treatment, when you go to the physio, unless that physio is really well educated, or when you do exercise, etc. Those patterns get reinforced again and again and again. That's why very often you can't exercise yourself out of the problems that you get from sitting all day. The other thing that can happen is emotions can create tight muscles. Sometimes when you react to fear, you actually contract your body, and there are people whose habitual way of dealing with life in general is to be fearful, and you can see them in slightly contracted posture. But it can also be very subtle in holding in your chest, in tucking your pelvis under like your tail's between your legs. The other way is to get really tough, like Arnie here, and, go around with great bravado. And this is a form of muscular armoring as well. The other thing is when you get stressed and when you stop breathing. All of these, when you're doing this time and time again, these create muscular tension. And unfortunately, in the dental chair, we're in a state of stress most of the time. And so there's muscular patterning that pulls in, that doesn't help with anything you're doing. But unfortunately, it does affect where you are in your work and how you move, etc. We all know about bruxism and how that doesn't just affect the jaw muscles. That can affect the neck muscles. It can affect your face and all the way down in the rest of your body. So these patterns also get plumbed into your neurological straitjacket, and they're not there to a great degree all the time, but they can do that. And this is where that muscular tension can actually cause problems. So it becomes part of your neurological circuitry and becomes part of your everyday existence. So neuroplasticity, what exactly is neuroplasticity? Well, neuroplasticity is a way that you can actually change that neurological patterning, can change it in a positive way. So how does it do that? Let's look at how we can use neuroplasticity to change those habitual patterns. The first time that you ever put your hands together in the way that you do now habitually, it starts to create a pathway in your nervous system. It goes to the spinal column, up into the brain, then that starts to connect with other parts of your brain. And then what happens is that circuitry gets more and more thick, so it becomes a well-worn pathway. And that's why it's so habitual. So we have a whole lot of these habitual pathways in our system for all the things that we do. And this is good and it's bad as well. So what happens when you start to hold your hands in a different way, with your hands with the other thumb on top? Well, it also starts to create a pathway which goes up to your brain, and then that starts to connect with the rest of your brain. And the more you do this, the bigger that pathway and the more connections. And what can happen is that new habit can be just as much as the old one, so you have two possibilities, or it can even take over. If your body decides that new way of doing things is better than the old way, it will take it on. It's intelligent. So my dear friend Buckminster Fuller said, "You never change things by fighting the existing reality. To change something, you have to build a new model that makes the existing model obsolete." And it's exactly the same with this patterning. You never change by fighting the existing old habit. To change that old habit, you have to create a new neurological pathway that makes the old one obsolete. And by the old one, I mean the one that's causing you pain. So the sorts of things that we can change are, if, for instance, you're holding one shoulder up higher than the other, we can help you to understand how to let that go. We can also change the way that you breathe at work. So when you remember, you can breathe more fully. The other thing is to help you to sit properly, and this is what I'm going to teach you later. And the other is to help change your life so that you're not miserable and in pain all the time, so you can be a bit more joyful. I think that would be really nice. So what we do with our Feldenkrais method is that by either moving you around in a personal session or in classes, the teacher will make suggestions about movements. What happens is by doing this with awareness, we help you to start to feel exactly where it is that those old patterns are holding. You can feel the constriction, and then we make suggestions about moving differently. Now, because we get you lying on the floor, we get rid of the effect of gravity. So you're much more in a position to become more sensitive and start to feel what's going on in your bodies. And this can be quite amazing. We're going to do some of this. We call these awareness through movement lessons. The hands-on work is called functional integration, which actually we take you through those movements to help you feel where it is you're holding on to. Now I'd like to talk about fascia. Fascia is something that the medical people are only just finding out about and raving about it because it's so interesting. Fascia is that tissue when you cut up a piece of steak or a piece of meat. It's that stringy stuff that goes in between all the muscles. And the amazing thing is that it covers our whole body. A scientific report says that there's this new structure that they've found that's amazing. That, I've known about this for over 35 years. I did training in craniosacral therapy. I've read Tom Meyer's book about anatomy trains. And I've also studied acupuncture, which also takes note of the structure of fascia because electricity is not just conducted through nerves. It's conducted through acupuncture meridians and also through the fascia. So the fascia starts off, as you can see in this top picture, as the tentorium cerebellum, etc., that's in the brain inside the skull. It separates the parts of the brain. Then it goes down through your spinal cord, and then it comes out through the vertebrae, out, and it wraps around all the muscles all the way out to your fingers, all the way down, covering over your organs, and all the way down to your toes. It's an amazing structure, and it's very, very active. So Helen Langevin from Harvard University has been doing these amazing studies where she's been taking cross-sections through tissue, but they're still able to move, they're not fixed. And she's looking at the action. If you'll see that you've got the skin here, then you've got the subcutaneous fat, and then you have these layers of fascia that cover over the muscle. Now, what she found is when the muscle moves, these fascia, the layers actually slide over each other. And this what helps give us more movement. And if you can have a look at the fascia that covers the whole of your body, they're organized in functionally connected sheets. They cover the muscles. And what this means is that when you've got something happening in your neck, you can't just treat the neck because it's connected down to the pelvis. And it's also connected down to your legs. So this is why in the Feldenkrais method, we treat the whole body, because just treating one part, that part has also created tension in the rest of the body. So I'll give you an example of that. I had a lady who came in with ongoing problems with her right knee. And she'd been to the physiotherapists, and I'm sure they were really, really good. They treat her, and then she'd come home, and it would come back again. So I asked her, what did you do to your left leg or your left ankle when you were a child? She said, oh, how do you know? She said, I had a really bad fracture in my ankle, and it took a long time to heal. So what has happened here is that when she had that fracture, she started walking more on her right foot and the right leg. And what I discovered when I stood behind her was that she was putting more weight on that right leg than on the left leg. So that pattern was still there. So what I did with my hands-on work with Feldenkrais, I gave her a direct experience of feeling gravity through both of her legs and taught her to stand both of her legs at the same time and put even weight. And she had no idea of this. It also distorted the way her ribs were. The ribs on the left-hand side were more contracted. So we got the whole body patterning of standing just on one side. And we made it so she could stand on both sides. And the pain never came back. So that's how we think about this. That's how I want you to think about what's going on with you as well. Now the fascia, from this beautiful article in the Scientific American, notice that the natural bodies, cells, small organisms, they all are constructed using a common form of architecture known as tensegrity. Now, tensegrity is how the fascia work. So what is tensegrity? These also are structures that were understood by Buckminster Fuller, who's a very clever inventor. So tensegrity structures have two elements, struts, which are compressible, and cables, which are tensional elements. If you have a look at this model, the compression aspects are the sticks or the wooden rods, and the tensional elements are the elastics. Now, you'll notice that none of those compression elements are joined to each other at their ends. They're all connected by the tensional elements. Now, the amazing thing about these tensegrity structures is that they have enough strength to support themselves, but they're flexible as well. So some examples of tensegrity structures in real life are the beautiful bridge over the river in Brisbane. You'll notice that none of the struts touch each other. They're all held together by cables. Then there's this beautiful tower in the middle that holds itself up as well. And then there's this gorgeous little table. And you'll see there's no solid elements between the top and the bottom. It's all held together with the elastic elements. Now, the interesting thing about tensegrity units is that they're very flexible. So if you take this structure on the left, and this is a baby's toy, which I love because it is a tensegrity unit, and you squash it, it moves and it's flexible, but it also, you take your hand off and it can come back to normal. Now, the amount of flexibility is decided by the tensional elements. So these ones have elastics which can be easily deformed, just like muscles and fascia. But when you build a bridge or a table, they have to be less flexible. So you put wires which still can be deformed, but they don't deform quite so much. So fascia actually works by biotensegrity. You can see this body on the right. It's a model of how it works. And fascia is what holds us together. It's a network that suspends all our organs, and it relays messages. And if you took all of your organs out, all the nerves, all the muscles, your body would still hold up. That's pretty amazing, isn't it? Just with the fascia. So the body is a biotensegrity model, And the bones are actually the compression elements, and they are floating in a sea of fascia. The fascia are the tensional elements. I want you to think of your body more like this, as the bones floating in a sea of fascia. But this can only happen giving flexibility and stability if the muscles are free to move. What happens is we tighten ourselves in various ways to keep ourselves steady for working, but we become rigid. But what I want to teach you is how to find your stability that has flexibility. That's a much better way of doing things. So when you have tight muscles, you lose your tensegrity, and this leads to rigidity, which leads to pain, unfortunately. So what Helen found was that when these muscles get tighter and when they get older, those layers get stickier unless you're a person that does a lot of activity. So the more you hold yourself in one position, the more these layers get sticky and they don't move over each other, and that's how you lose your elasticity. The good news is we can get that back for you. Maybe not to where you were when you were 20, but certainly where you are now. So let's show how tight muscles can affect the whole body. This is my biotensegrity toy, and you'll see how it moves. See how the whole of the body moves when you move just one part. The whole body moves. But if we cause one part of it to become constrained, which I've done with this brown elastic that's imitating a really tight muscle, maybe in your neck or your lower back, look at what it does to the whole structure, the movement of the whole structure. See how it doesn't move so far? And you can almost feel the tension there, can't you? The whole body is affected by that tight muscle. This is one of my favourite people to study, Professor Stuart McGill from Canada. He's done a lot of study of exercise and lower back pain, etc. And what he says is to improve the function of your body, you first have to remove the cause of the pain, which is the perturbed motor patterns in the whole system. What we're talking about is the equivalent of those tight muscles that might be just in one place or it might be in more, because we've lost our tensegrity with that. So let's talk about posture. When we look at our spine, because of the way the fascia works, the organisation of the vertebrae, they were meant to work like springs. And this is why posture is not a fixed thing. It's actually very dynamic. And if we lock ourselves into one position, that's when we cause ourselves problems. Posture is actually about aligning your skeleton little bit by little bit all day long to get yourself aligned so that the forces go down through the bones and not through tight muscles. Posture is not a static thing. What we're doing is aligning our skeleton, aligning our whole system, in fact our whole skeleton, so that the forces go down the middle. And this allows the weight to be taken by the compression elements, which they're designed to do. And because of the design of the tensional elements, they also help to not make the weight on the joints too much. But if you've got distortion and tight muscles, the weight's going to go down through the tight muscles. And that's why you develop tight muscles during the day, unfortunately. So the question is, what pulls you out of alignment? I have found 5 bad habits. And here we go. I'm sure you'll recognize yourself in some of these. The first one is simply holding your breath. Have you noticed that when you get stressed out or you're concentrating a lot, you're holding your breath? So how do you do this? You do this by contracting the muscles in between your ribs. You make them tighter. You constrict your diaphragm. And the result of that is, first of all, you get a foggy brain, and that's why you end up having a headache at the end of the day. And the other thing that happens is that you pull your skeleton out of alignment and you don't remember to breathe. And unfortunately, this is a habit that's unconscious. And what you're not aware of is that tightness then spreads to the rest of your body. The second one is putting your head forward to look inside the mouth or to look at the screen. It's slouching forward to see better. So you can see with the students here, they haven't done my course, but look at the shape of their back. It even hurts, for me, it hurts just to look at what they're doing. They should be either wearing loops or learning how to sit properly, which they did. So when you're slouching forward to see better, look at the shape of the vertebrae. Your pelvis rolls back, your neck gets really cramped, and you come away from that beautiful alignment. So one of the things that you can do for this is to get yourself some loops or start to use a microscope or just learn how to sit properly forward. And unfortunately, this is trouble. So I want to show you that how, in fact, those muscles at the top of your neck are functionally connected to your eyes. Have a look at these two little yellow semicircles. I want you to take your forefinger and just put them on either side, just underneath the lump that the skull makes, where those yellow dots are. Put your fingers there, make the touch very, very light, and then close your eyes and flick your eyes from left to right. And you'll probably feel, if your fingers are really light, you'll feel some flickering in those muscles, because those muscles are functionally connected. So what do you think you're doing to your neck when you're staring hard either at the screen or into the patient's mouth? Recipe for disaster. The next habit, the third one, comes from the startle reflex. So you know, if you stand next to a really bad explosion that goes off suddenly, your shoulders go up, your knees go in, and you go into flexion in your body. But what you're not aware of is you can have little mini doses of stress during the day. And every time you get a little mini dose of stress, you can activate that startle response. Have you ever noticed that during the day your shoulders get very tight, and in fact they're up near your ears? And that doesn't actually help you to do the work that you need to do. So one of the things that we do is I teach you how to use your shoulders a lot better and to actually mitigate the effect of that startle reflex. And now I want to have a serious discussion about this. This is about not stopping when you should. The pain is actually a fire alarm in your body. And it means you've got to stop, you've got to do things differently, or at least pause. But what do? We turn off the fire alarm, take a painkiller, pretend it's not happening, and work through it. And we keep going, and this is insane. So I want to have a serious talk about not doing this, because you're causing more damage to yourself. And even the experts are saying you have to take a rest regularly. And I think that's very true of people who sit all day at work. And the next one is how we sit in chairs. This is how our body was designed to sit. Look at the beautiful shape of the spine. They look very stable. Their hands are free to move. Beautiful alignment, etc. Can you see a chair anywhere? No. Our body was not designed to sit in chairs. We were designed to have our body, our skeleton and muscles and fascia work as a spring. And unfortunately, chairs get in the way of that. This is how we sit. So can you see good alignment here? I can't, unfortunately. So the Valaches, he's a dentist and she's a physical therapist in the USA, did a very large study on dentists, asking the question, why is it that people who work in the dental profession have so many problems? Well, their first conclusion was that the problems are multifactorial, which means we don't know what we can do about it. And they did say that, in fact, dentistry is a very physical job, and it is. It does take stamina to do the job very well. But what they did was they noticed that people hold themselves in positions that require more than 50% of the muscles to remain contracted and stationary. Now, this is what they said led to what they called prolonged static postures. Now, if you hold yourself in a prolonged static posture for long enough, unfortunately, it's going to stay contracted for a lot longer. So, look at this, absolutely full of PSPs, absolutely full of them. This is how you end up with problems, unfortunately. So, as I said, with our lessons, what we do is we make you aware of your prolonged postures, and we help you to undo them and find better ways to align your posture. Now, to do that, you actually need to become more sensitive. So what we need you to do is the lessons that I'm going to give you today, I want you to do them not thinking of them as exercises. I want you to think of them as explorations. Explorations to find out how your body works. So let's hope that you enjoy it. So if you decide that you get a lot out of today, I'd like to encourage you to do ongoing lessons. I have some on Zoom. I do regular classes on Zoom, and I have workshops for practitioners and dentists, and I have some for your patients as well. So if you want to know what's going on, look up Dr. Penelope Jones at workingposture.com. Look up my website, which is www.workingposture.com.au, or look me up on Instagram and Facebook at my Working Posture pages, and I'm going to give little exercises, little lessons that will help reinforce what you do today, because you don't want to go home and just completely ignore what you've learned today. The more you do this, it's like to create a new habit, you have to keep coming back to it again and again with awareness. So thank you and enjoy the day.